Hi everybody, I'm Dr. Shiau Ee Leng. Today I'm going to share with us the various types of botulinum toxins available in the market and which one is suitable for you. So the three main types of toxins or botulinum toxins available in Singapore include Botox, also known as Dysport, Dysport, also known as Xeomin, and Xeomin, also known as Botox. So oftentimes I have requests from patients on which is the most suitable toxins for them. So pardon the names, but let's refer them to Botox, Dysport, as well as Xeomin. So right now I'm going to share with you what we know about these toxins and how we can help you to make the right decision. For additives wise, Botox and Dysport are known to have accessory proteins attached to the botulinum toxins inside. So for Botox, it is a kind of protein with egg inside or egg-based protein. For Dysport, it is a protein that's linked to the lactose molecule or the cow's milk protein molecule. For Xeomin, it has minimal amount of accessory molecules. So that's why they like to call themselves the pure toxin. So Xeomin, because it has no accessory proteins, I thought by scientists to have a less risk of allergic reaction as well as the production of autoantibodies against the toxin, which means that if you do many sessions of this Xeomin injection, there's a very low chance for you to get any form of rejection or antibody production. Whereas comparatively, the other two like Botox and Dysport do have these accessory proteins of either the egg or cow's protein, which people believe that there's a chance that it can develop these antibodies and has a slightly higher chance of allergies. However, these accessory proteins have been found to make the injection products last much longer, and also it seems to make it more comfortable to inject as well. But however, if you do have allergies to egg or to cow's milk protein, then for sure Xeomin is more suitable for you. Next is actually the molecular weight of the toxins versus the diffusion distance. Botox and Xeomin have similar molecular weight and structure, and it tends to be bigger compared to Dysport, which has a smaller molecular weight. So as a result, Botox and Xeomin tends to stay exactly in the same place as injected. So it is suitable to be injected at areas that we don't want the Botox to move away, like for instance the eye area, the crow's feet area, the glabella area. So these are the areas we want the toxins to stay exactly where it is injected, so as not to have a very stiff expression. By comparison, Dysport with its smaller molecule size will tend to diffuse or move to a wider location outside of the injection area. So it is preferred to be used for injection of larger muscles such as the masseter muscles at the jaw area to slim down the face. We also like to use it for injection of the calf muscles to slim down the calf muscles, as well as the shoulder muscles to slim down the shoulder area. In terms of dosage, you will probably notice that Dysport seems to have a much higher number of units used compared to Botox and Xeomin. So for instance, each injection point for Botox and Xeomin is 2 to 4 units per point, whereas for Dysport, it is 5 to 10 units per point of injection. So therefore, the conversion is about 2.5 times higher. So cost-wise, I would say the most expensive toxin currently is still Botox, which is the most famous botulinum toxin in the world because it has gone through the most amount of research on all its users and it has a very wide usage throughout the world. Then this is followed by Xeomin, which is a newer comer to the market. So Xeomin cost is maybe about 5 to 10% cheaper than Botox. By comparison, Dysport, because its dosages is about 2.5 times higher, Dysport tends to be cheaper than Botox and Xeomin by about at least 10 to 15%. And Botox and Xeomin have similar onset of actions from 3 to about 7 days of onset of action, whereas Dysport seems to have a shorter onset action, about 2 days to 3 days. As for duration, it's all similar between the three types of toxins, so they both last anything from 2.5 to 4 months. The duration actually is limited by also our own body's metabolism. So if you have a high metabolism rate, like exercise a lot, you just burn things off very quickly, and then your toxin action will last shorter. So now I'd like to discuss the benefits and the drawbacks of the various types of toxins. So for Botox, because it doesn't diffuse much from the injection point, it is very beneficial for injecting into precise areas, such as the corner of the eyes, near the eyebrow area, the forehead area, but we do not want the toxin to shift and have an unusual or very stiff looking facial expression. The drawbacks is it might develop antibodies over time if high doses of toxins are used for many years. However, I'd like to highlight that compared to many years ago, when Botox was used for treating people with strokes and muscle cramps, where the dosage used is 10 to 20 times higher, currently the dosages used for aesthetics is so little that the chances of developing antibodies is extremely minimal. So for Dysport, its benefits is that this is a molecule that can diffuse to a larger area. So it is very good for injecting into places that we want the molecules to move, such as the masseter muscles of the jawline, the calf muscles, as well as the shoulder muscles. So it is also more cost effective if larger muscles need to be injected because you need a lot more toxins. So of course, its drawback is that it is not suitable for people with allergies to cow milk protein. Okay, Xeomin, as you know, is called the pure toxin, meaning that it has very little accessory protein. So it's good for people who are already having antibody in their bodies due to frequent injection of toxins, or they find that they're not getting good results with Botox or Dysport. Then it is time for them to try Xeomin. The drawback is some people may notice the onset time is slightly longer or it may last shorter. So therefore, in summary, which toxin to choose will depend on quite a few factors. Firstly, on the areas to be injected, whether it is the fine muscles around the eye area or the upper face, where we want to retain facial expression without having very stiff look. If it is for larger muscles group, we will actually prefer to use this part because it has a benefit advantage for this large muscles injection. And next, it will depend also very much on the injector's skills and technique, so that the placement of the toxin is correctly placed, such as not to have uneven or unnatural results. Finally, it of course will depend very much on the patient's own body, because your body will react to the toxin in your own unique way. So for some people, the toxin can last a much longer time for them. For others with very high metabolism rates, then they actually need more frequent or higher dose injection. I hope this answers your queries.